Hello, we are a task force in the Ministry of Health specializing in the Republic of Moldova. In our study, we have taken into consideration basic health indicators, population dynamics, and trends. The Republic of Moldova has a predominantly greater non-communicable disease value than the communicable, maternal, perinatal, and nutritional conditions category. Non-communicable diseases are non-infectious or non-transferable among people, and because this is significantly higher in value than communicable diseases, it means that the epidemiological transition has already taken place in Moldova. Education, nutrition, hygiene, and other contributing factors aided in reducing the occurrences of epidemics in this country, shifting the burden of disease from communicable to non-communicable. The top causes of death in Moldova are diseases of the circulatory system, followed by cancer and diseases of the digestive system. According to the World Health Organization, we have identified the three main public health issues and risk factors that are related to these causes of death.
During our projects, we found that consumption of alcohol and tobacco were two of the major issues facing health in Moldova. They are major issues because they're causally related to two of the top killers or two of the top diseases that kill people in Moldova, which are disease of the digestive system and cancer. Tobacco, we know, is related to lung cancer, which can even affect non-smokers from secondhand smoking effect. And alcohol can affect the liver, can cause cirrhosis of the liver, which can lead to death. Tobacco and alcohol consumption can also be related to mental disorder. In a study run in Great Britain in the year 2000, they found that the CISR score of above 12, which indicates the presence of a common mental disorder, was more common in smokers than non-smokers.
Overconsumption of alcohol and tobacco is in direct relation to the next main public health issue, which is mental health. There is a fragile balance of chemicals in our body that allows us to feel, think, and ultimately make us who we are as a person. Alcohol as a depressant alters that balance, and consuming too much of it over a long period of time leaves permanent damage to the brain, leading to mental health disorders. Some mental health disorders are hereditary and may pass the disorder to children. Since Moldova's maternal conditions are low and the amount of successful births increase, these mental health disorders are likely to be passed down. Disorders that are only part of the problem. Overall, mental health in Moldova is being affected from stress and anxiety occurring every day. People that receive lower incomes, have households with 3 or more children, are in rural areas, relying on self-employment, and the elderly are known to experience mental stress. Having a stable and healthy mind is vital to the human race, and Moldova is falling behind.
Tuberculosis is another issue we chose to prioritize. Respiratory diseases are one of the top causes of death, and this is because there is a causal relationship between harmful tobacco use and drinking of alcohol, and incidence of infectious diseases such as TB. The incidence and mortality rates for TB have dramatically increased over the years. TB is airborne, and although children are more particularly difficult to diagnose, they are the most susceptible to infection. Those who live or work with others who have been diagnosed infected with the disease are also most at risk. The numbers have more than doubled, reaching 182 per 100,000 people in the year 2010. Given local community support and governmental aid, TB, although an easily spreadable and communicable disease, could be prevented and treated when medicines are provided and taken properly.
Our recommendations for targeting tobacco and alcohol consumption is implementing educational prevention programs in schools. We believe that educating adolescents on severe health effects will deter them from using substances. We also recommend educational programs to teach students about better diets and enjoying physical activity. Furthermore, we urge the government to raise legal age for drinking and tobacco consumption from 18 to 21 years of age, and to raise taxes on these substances. For aftercare measures, we believe that rehab programs should be extended to recovering alcoholics or alcoholics seeking help to get better. These programs should be easily accessible and encouraged by medical physicians. For mental health issues, we want to research current stigmas and views on the issue itself. From there, we can address negative stigmas towards mental illness, or if little is known in Moldova. Raising awareness through posters, the media, and medical care is the next step. We need to aid this education with encouragement and programs to care for those affected with mental issues in schools, universities, and workplaces. These services for people dealing with mental health illness should be at little or no cost to them. We ask our medical workforce to actively try to reduce TB incidence through vaccinations. The vaccinations need to be accessible and affordable. There also has to be more education of all levels on tuberculosis. Medical professionals should be encouraging this education and even educating their patients themselves. Posters and pamphlets will also be implemented in hospitals and clinics.